Can therapy help with ADHD? This is what we're going to answer today. Now, a lot of people think about medication management, they think about ADHD coaches when it comes to ADHD. But what about therapy? Does that help with ADHD? That's what we're going to answer today. By the end of the video, you will have an answer. But before we do, let me introduce myself. My name is Matt. I'm a therapist in private practice. I own PRGRS Therapy. We are a small private practice located in New York City, but we do serve folks all across the state of New York. One of our specialties is ADHD. And you could guess that we think therapy is very helpful for ADHD, which is why we offer that to our clients. Now, I do want to answer the question, and I'm going to try to keep it brief. We don't have all day. We don't want to spend all day on this video. But let me explain why ADHD or why therapy is absolutely helpful for ADHD. Now, when it comes to ADHD, there are a couple of layers that we need to address. Number one, there is practical skill building, right? Now, this is where people think about coaches. So skill building around, time management, procrastination, right? That blends together, calendars, like all that kind of stuff, right? These we would consider practical skill building, right? Executive function skill building, whatever you want to call it, right? Now, a therapist is able to help with that practical skill building, but a therapist is also able to use evidence-based interventions or evidence-based skills and tools. For example, DBT therapy, CBT therapy. We're able to use these alongside practical skills as well. A coach is limited, right? A coach is technically not a mental health provider and is not able to treat a mental health condition nor use evidence-based tools and skills that only a licensed professional can use. So oftentimes with our clients, not only are we going to teach skills that are practical in terms of time management and procrastination and all the other things, but we're also going to introduce evidence-based skills and tools. One of the major ones we use is DBT, dialectical behavior therapy. I will make a whole video about that itself, but just to put it really simply, DBT is an evidence-based intervention shown to be effective for a lot of different mental health issues, and ADHD is one of them. So therapy is not only able to do practical skill building, right? But we're also able to use the evidence-based skills and tools as well, all right? Now, number two, when it comes to ADHD, there's a lot that you cannot see. Now, on the surface, we might see things like procrastination, time management, lack of focus, all these things. But underneath, there is a lot of shame, there's a lot of guilt, there's a lot of trauma that occurs. There's just a lot there that practical skill building is not going to touch, right? And so learning practical skills and tools is only a part of the work. There's a layer that needs to be addressed that is much deeper than that. And coaches, again, or medication management is not going to get at that layer, right? The shame, the guilt, what happened in childhood, all these different things. Now, I'm not saying that every single person with ADHD requires all these different interventions, right? But we do notice that there is that layer that often comes up for people. And a therapist, of course, is in a great position to help people manage the guilt, the shame, the deeper layers, right? So that's another reason why therapy can be very, very helpful for ADHD. Now, another reason, and people don't talk about this one often, is that as a therapist, right, you have specific training, hopefully, most therapists do, right, in mental health. So we're not just, well, hopefully, if we have the right supervision and the right support, we don't just get pigeonholed into thinking in one way. A mental health therapist, right, and that's not the actual name, there's LCSW, LP, all these different acronyms, but a licensed therapist, let's call it that, right, should be able to take a look at the bigger picture, right? So maybe we're dealing with anxiety, maybe we're dealing with depression, and maybe we're dealing with another mental health issue, and maybe we need to refer to a medicating provider, or maybe we need to, get another specialist on board. I'm not really sure. Every case is different, but a mental health provider is going to be aware of other mental health issues, whereas someone who's not trained in that might just get stuck thinking one way, right? Maybe, oh, it's procrastination because of ADHD or because of XYZ, but maybe there's something else going on that requires a different intervention. And so a therapist is going to be in a great position to have a broad overview of what's going on and what different mental health conditions look like, which can be really, really helpful. And so at the end of the day, right, I do think that therapy can be very, very helpful for people with ADHD. And then you might be asking, well, how do we track that progress? And that's going to be a topic for another video, but I do encourage you, if you are in therapy or anything like that, you want to set goals, you want to set intentions, and you want to be checking in consistently to see if we're meeting those goals and intentions. Now, just to be really clear, this video is not mental health advice. We are simply just sharing our thoughts and perspective. If you do need to seek out mental health care, please do so. Again, this video is not a substitute for mental health care. All right, well, hope you enjoyed this video. Check out our website down below, progresstherapy.com. There'll be more videos in the future. I hope to see you there. Have a great rest of your day.